I'm from Wuhan Union Hospital. Our hospital is one of the biggest hospital in the middle of China, and we have cured a lot of COVID-19 patients during this crisis. So, however, till now, I think we still have a lot of problem about this kind of disease. So a lot of questions. So but I just want to share my experience and to discuss with some strategy and how to manage it during this crisis. Okay, so we all know the COVID-19 outbreak in the whole world now, and we can see these are world epidemic maps. We can say in the February, and in Chinese condition is very serious. However, after only 2 months, the outbreak of COVID-19 in almost all countries. And till now, more than 3 million persons get the infection, and a lot of them died. So I think this crisis maybe is a big problem to the human being, and we can see this. This is increased new case per day in 3 countries: Italy, America, and India. So I think these 3 countries can represent the Europe, the America, and the South Asia. And we can see the increased trend is very similar in these 3 countries. The difference is only the Italy is the 10 days ahead of America, and America is 10 days ahead of India. So I think the COVID-19 should be is a kind of a viral attack to the human being, and every country and every person have to face. The difference is just sooner or later. So before we talking about how to manage the COVID-19 in the endoscopy room, first we try to understand this kind of disease. As to infectious disease, the basic reproductive number, R0, is very important. It means how many persons can be infected by one patient. And we can see this table summarizes the R0 of some common infectious disease. And the measles has the highest R0, is more than 10. And the SARS, another disease caused by coronavirus, the R0 is 2 to 5. And how many to the COVID-19? In this publication is published in the February, and we can see the R0 of the COVID-19 is 2.2. Actually, this number can change in different stage. We can see this is the R0 changed in New York City, and 1 month ago is get to the peak value is more than 4, and then now is lower than 1. So it means this disease is controlled partly in the city because the R0 is lower than 1. And from this publication, we can see another number is doubling time. Doubling time of the COVID-19 is 7.4 days. It means without control, this pandemic can be doubled every week. So it spread very, very quickly. And as to the mortality and severity of the disease, I think till now, no one considered the COVID-19 as a big flu because its mortality is much higher than common seasonal flu. And I calculated this number yesterday, and we can see the mortality is the 6.8%, but it's much different in different countries. We can see in Italy, the mortality is the highest. It's more than 10%. and in the Japan and in Germany is very low. It's 2 to 3. So maybe this difference is caused by different subtype of virus infection. But in my opinion, I think the reason is because the different level of the health resource supplies and the different strategy of management from the government. And as to the Chinese mortality is in Hubei province is much different from the other regions, and I think the difference is caused by at the point of the outbreak, we are ready or not, and the severity of the COVID-19, and we can calculate. For example, in the left publication, we can see the number of severe cases is 173. The number of the non-severe cases is 926. So we can calculate the severity of the COVID-19 is 16%. And in the right publication, and at about the 26% of cases are sent to intensive care unit. So almost all publication, the severity of the COVID-19 range from the 15% to 25%. Actually, is a little higher. And the incubation period of COVID-19 is 1 to 14 days. Most of cases present symptoms in 1 week. However, in some special cases, the incubation time can be longer than 3 weeks. So I think the most hollow of the disease is in some case, they can get the long incubation period without any symptoms. So it's easy to transmit the infection to around persons. This is the reason why in the 2 months, this kind of infectious disease can spread from the China to the whole world. So I think in China we have a joke. The COVID-19 can match anyone who says it doesn't matter. So we think this is a smart virus, and actually, as to a virus, maybe it's perfect. And how to diagnose of COVID-19? We have the three items and the contact history. The contact history means that you contact a patient without protection, or you have the history of the traveling in the epidemic region, and the contact way including just like this, the speaking or body surface contact or handshaking. And this is the last picture. These two persons can take a correct way because they keep apart from each other. Actually, if the person can stay further and they can get safer, it's very important for the personal protection. And as to the symptom of the COVID-19, we all know the fever is the most common symptoms. And the following is fatigue and respiratory symptoms. In some special case, in our experience, some patients can present on diarrhea and nausea or vomiting without the fever and respiratory symptoms. So it should be noted by gastroenterologist. And the second proof is the routine blood test. We can see this. The left figure shows the relation between the white blood cells and the time. The blue line represents the survivals, and the orange line represents the non-survivals. We can see in the mild case or in the early stage of the infection, the white blood cells should be normal. But in some severe case, it can increase. But this kind of increase often indicates the co-infection with bacteria or fungus. And the right figure shows the relation between the lymphocyte count and the time. And we can see in almost all cases, the lymphocyte decreased. And actually, the less of the lymphocyte often indicate the more severe of the disease. Actually, this is a kind of remarkable feature of the COVID-19. So the lymphocyte count decreased is very important in the early evaluation of the prognosis in the COVID-19 infection. And the CT scan, we will know the CT scan is very important, and the traditional feature of the COVID-19 infection in CT scan is the ground glass opacity. In the beginning, it often locates in the outer margin of the lung, one side or both sides, and the lower lobe. And with the developing of the disease, it can extend to the whole lung like this. However, this kind of change can be seen in a lot of respiratory disease. So it's not we cannot differentiate the COVID-19 from other diseases by this kind of image. Actually, in the early stage, the ground glass opacity like this is special to this kind of infection. And the last is the virological examination. In China, till now, we have the two methods to detect the SARS-CoV-2 infection. The first is the nucleic acid from the pharyngeal sample. And the second is antibody detection from the serum sample. And because of the negative, the false negative result, so positive result can confirm the diagnosis. However, the negative result cannot exclude the diagnosis. So if we suspect the patient have the infection, but we cannot get the positive results of the virological examination, our method is examine again the 2 times or 3 times. So after several times detection, if all the results are negative, it should be okay. So this is the virological examination. So according to this, the diagnosis of COVID-19 can be divided into 2 stages. The first is suspected diagnosis. It means if the patient have the contact history, the 2 or the 3 items, the traditional symptoms, the decreased lymphocyte, and the change on CT scan, it can get the suspected diagnosis of COVID-19. If the patient have no contact history, all these 3 items are needed. And the confirmed diagnosis, means the suspected diagnosis plus the virological evidence. So this is the diagnosis of the COVID-19. And after we know how to diagnose, I think we were concerned how to protect ourselves during the outbreak. And before I answer this question, I think it is very, very important to us to know the transmission route of the SARS-CoV-2. We will know this kind of disease can spread by the droplet and the close contact. However, the close contact is much more than contact a patient, because the virus can survive in the smooth surface for several days. For example, such as the stair armset, the door knob, and the elevator buttons. So if we touch a contaminated surface, we might get the infection. So, and besides the close contact, there are some possible transmission way of the COVID-19. First, because Chinese researchers have isolated the liver virus from the patient's stool. And this figure, we can see the ACE2, a receptor of the COVID-19 and of SARS-CoV-2, and the other virus protein can express in both the GI tract from the esophagus to the rectum. So we believe the oral fecal transmission is possible. And in this publication, we can see the researchers have get the nucleic acid of the SARS-CoV-2 from the patient, the tear samples and the conjunctival secretions. So the conjunctival transmission is also possible. So we can conclude the endoscopy unit staff are at high risk of transmission because in the procedure we might get the contact of virus, and we might get the infection by the inhalation of virus and touch the contamination or other splashes for the conjunctival transmission. So how to minimize the risk of the infection? I can answer this question from the 4 aspects: the patient screening, and the staff protection, and the endoscopy room disinfection, and the material management. First, as to the patient screening, during the outbreak of the COVID-19, we should pose the routine procedure. Actually, in the beginning of the outbreak of COVID-19 in China, the CSGA suggests we pose the low essential procedure, and the procedure can be performed only in emergent cases such as GI bleeding, the foreign body in GI tract, the obstructive jaundice with infection, the biliary acute pancreatitis, and the feeding tube placement. So actually, in the February, in our hospital, we almost stopped all procedures, and from the March we start to re-perform the procedure again. And before the procedure, the patient should get the temperature, the CT scan, antibody, and nucleic acid detection. If the low suspected infection, the patient can go to endoscopy room for the procedure. Otherwise, they have to be sent to the negative pressure room for the procedure. Actually, not only the patient screen, not only before the procedure, before the hospitalization, all patients have to get the same method of the screen, and any people can stay in the hospital after the screen. And if they have some suspicion, they have to be sent to the fever clinic for further examination. And as to staff protection, before the procedure, everyone have to check themselves, just like the patient screen, the symptoms and the contact history. Actually, and before we restart our work in the endoscopy room, all staff have to examine the virus antibody and the nucleic acid. So if the result is okay, we can go to work. Otherwise, we have to get the isolation and the treatment. And in the procedure, we have to get the different level of protection. The PPE, I think, is very, very important in our work to the medical staffs. If the patient have low infection, the level 2 protection is enough to the clinical staffs. And if the patient have the infection, the level 3 is recommended. And what is different in the different level of the protection? We can see this is the different level of PPE, and the first is the level 1 protection. It means the medical staff have the medical cap, mask, gloves, and working clothes, just like this. And the level 2 means the level 1 plus the mask. The mask can bury the virus, so N95 is recommended. And the gowns, the eye shield, and the shoe cover. And the level 3 is level 2 plus the mask respirator. And the double gloves is necessary. So this is the image, is the picture of our PPE in our work. This is the work in the outpatient center, and this is the shoe cover, and this is I did ESP. We can see we work with the level 2 protection. And these two, I got the two fig online. The first is the Chinese medical staff work with the level 2 protection. We can see the protection is enough. So after February, is rare to see the Chinese medical staff to get infection because the protection is enough. And the right picture, we can see the protection is not enough because the blood surface appear in the eye, and from the shoes we can see it's not covered. So the protection, if we work with this kind of protection in the front line, I think the infection is unavoidable. And how to put on and remove the PPE. I think a lot of medical staff will concern the progress because actually it's very, I think it's a little complex to the common staff, medical staff. We can see as to the put on is from the step 1 to step 5, and as to the removing is a little is more complex. We often take more than 20 or 30 minutes to remove our PPE from the step 1 to step 10. As to the progress, I have 3 points to address. The first, we need a separate area or room. This is a separate region between the endoscopy zone and the cleaning region. So in this region, we can finish the step 5 to step 10 of the removing PPE. This kind of the area is very important. The second is we know the progress is a little complex, so sometimes we may make mistake because of our attention or our forgetfulness. So, but if we work on the front line, any small mistake might cause the infection. So it's very, very dangerous. So our but in my experience, to new guys about this progress, so I think almost everyone will make mistake. Even you repeat this progress very a lot of times, you have made you sometimes you still make mistake. So our experience is we have a training person to watch. Uh, they can point out only mistake when they find. If you make a mistake, they can point out right now, so it can avoid a lot of risk of the transmission. So this is very important. And the third point is with PPE, we cannot work alone for a long time because we have a medical staff. She gets the cardiac arrest for a long time, for long time work in the separate region, and the reason is the hypokalemia. Because in a lot of countries, including in our city, the PPE is very how to say, is very important, but is very you cannot get a lot of PPE, so we have to save as much as possible. So if you work with PPE, it's difficult to go to the restroom. So a lot of medical staff will stop the eating and drinking before they have the PPE. So, but they work with the tension and with a lot of sweating. This may cause the hypokalemia. So it can bring a lot of danger. So after this case, but it's fortunate they can she was found right now by her colleagues. But so after this case, we have rules. So everyone cannot work alone. They have including the removing the PPE, the 2% to can work together, work and do together. It can make safety. So this is important. And after the procedure, we have to disinfect body surface. Especially it contact the contaminant. And the hand hygiene is very important because we all know the hands is the most the most easy part of the body to contact the contaminants. Okay, even in the procedure, I remember I have to make a mistake. In the procedure, I move my hands to my face, so my assistant to point out is wrong, because the hands is very you can see the hands is very dirty, and I move to my face because I feel some discomfortable of the in the face, or we can in some time the eye shield is not clear. So you try to clean the eye shield, but it's very dangerous. Don't move your hands toward your face in the procedure. When you use the hands to touch the other part of the body, you have to take off the outer gloves. So the inner gloves is clean. So this is we should take care about the hands, and because the COVID-19 virus is very sensitive to the alcohol, hydrogen peroxide, and hydrochloride. So in our center, of the disinfectant contained one of these three active ingredients. And because of the long incubation period, so after the procedure, we have to follow the patient for 2 weeks. Sometimes the infection of the patient is diagnosed in this period. So if the infection is confirmed, the contact staff should get the isolation and the evaluation, the more evaluation of the risk. So this is our procedure to the how to protect ourselves. And as to the endoscopy zone, first, I think a single isolated the zone is used in the procedure during the outbreak of COVID-19, because in this in the crisis we don't have a lot of procedure, so we don't need to open all the endoscopy zone. For example, in our hospital, in our endoscopy zone, we have the 15 procedure zone, but only two were used in the during the crisis. Now we have opened six zones. So according to the risk of the transmission, we can open the zone step by step. And if the patient have the suspected infection of COVID-19, the negative pressure zone is recommended. If I know in some hospital we don't have the negative pressure zone. We have I think the single isolated zone with the good ventilation is needed, because if sometimes, because in our city the infection case and the non-infection case have been placed in different hospitals, so we don't have to face this kind of problems. But if in some hospital you have to face the different patient, the infectious or non-infectious, you have to divide your endoscopy zone to two parts. One part for the infectious case, and the second part is for the non-infectious case. So this is important. And after the procedure, we have to disinfect all surface in the zone, which contain the active disinfectant. And UV irradiation and ozone treatments are recommended for air cleaning and sterilization. And after the air sterilization, we open the window to we often open the window for half 1 hour for the ventilation. And we have a machine to check the quality of the air in the endoscopy zone every day, to check the number of organisms, and it should be okay. So it can maintain the safety of the procedure zone. And another situation we have to care is the central air condition, because it's different in different countries or different situation. We will know the SARS in the 2003, the SARS, the disease caused by another coronavirus. It can transmit by the central air condition. So from the beginning of the outbreak of COVID-19, in our hospital, we turned off the all air condition till now. And in some country, I know is different, because in the air condition they have the filter can block the virus. So I think so we have to ask the related technician to confirm the central air condition system is safe or not before we use it. This is important too. And to the management of materials, first we should keep the all material in good order because it's only for the easily cleaning. And always the separation should be placed in the bags and sealed and labeled clearly. And this kind of bag, the waste should be covered with by some other cleaners. So this can minimize the risk of the aerosol transmission. So this is what we do during the outbreak of COVID-19. I think in this crisis, the global medical staff have shown the braveries. And in China, I have been touched a lot of times by the Chinese medical staff's the spirit and power. And actually, I think till now, I was touched one by one times again. Well, I know in a lot of countries, a lot of retired doctors and a lot of medical students are applying to go to frontline to fight against the COVID-19. And yesterday, Chinese news in Chinese the TV the news reports a doctor from Brazil, a Brazil doctor, after the cure of the COVID-19 infection, he went to the front line again. So I think I was touched by the sentence. I will come is very common in the other countries. Besides this, today I want to say, what we need in this crisis are much more than doctors and nurses, because even almost all medical staff are supermen. Is not enough. In the beginning of the outbreak of COVID-19, we have the same feeling. The more patients we treated, the more new patients we have to face. So I think the treatment is very important, but the breaking transmission way is more important. And how to break the transmission route? There are two steps. Find all suspected infection and isolate all the patients. It's very easy to say, but it's very, very difficult to do. It needed powerful government management and the cooperation from everyone. Actually, in this crisis, I think everyone is fighters. Our doctor to cure the patients for fighting against the COVID-19, and the patients get the isolation and the treatment also for fighting against the COVID-19. And someone deliver the supplies for fighting, someone clean the city for fighting, and someone working day and night for fighting, and someone only stay at home also for fighting, because everyone are fighters, because of our cooperation and union. So I think we get the steady success in China, and this is the increased new case. Chinese increase new case per day. We can see this value get the peak on the February 12th. In Wuhan, this number is more than 30,000. I remember at that time, we have a little worried. We have a little picnic because we didn't believe this number can decrease. We can take only 1 month to decrease the number from more than 10,000 to less than 10. So actually, if we can break the transmission way, this number can decrease at an unbelievable speed. So we have to be confident about the disease, but it is very important is we must break the transmission way. We have to follow all infectious case to find the reason, the transmission route. This is, I think, is more important than the treatment. So, because this kind of disease can spread very quickly, so I think no person can sustain safety alone, and no country can make the safety alone. Even after we get the stage success, we still have to face the second wave of the risk of the second wave of infection, because we get a lot of new cases from the around countries. So I think this situation is the same to all countries, because we live in the same planet. So we have to stay together and fight together. And even this, we can get the final victory. The final victory means we can control the outbreak in the all countries. So I think after because of union and cooperation, we can get the final victory, and nothing can stop us. Thank you.